When older adults begin to lose their hearing and slip in their memory, we usually brace for a tragic reality. We tend to accept this sensory detachment and mental fog as an unavoidable, permanent symptom of neurological decay. But recent research reveals a biological connection between the ears and the brain that challenges this assumption. A landmark study from Japan shows that some of this mental decline is reversible through a clinical screening process that most families aren't even aware exists. What researchers found is that a significant portion of this perceived neurological failure is actually triggered by a physical barrier, one that is entirely treatable. This is cerumen impaction, when earwax blocks over a third of the ear canal. Though Japanese people typically have lower risk dry earwax, aging halts the ear's natural cleaning mechanism. By their 80s, over 1 in 5 adults live with this severe physical blockage. What looks like a failing mind may actually be a feedback loop intensified by this blockage, cutting the brain off from the stimuli it needs to stay sharp. The immediate physical impact is substantial. A dense wall of hardened cerumen can cause a 40 decibel drop in hearing capability. Researchers at the National Center for Geriatrics and Gerontology discovered that this loss of sound triggers a self-perpetuating feedback loop. Cognitive decline starts the cycle. As self-care becomes difficult, unmanaged earwax silently accumulates, eventually hardening into a total impaction that creates profound hearing loss. Starved of sound, the individual becomes socially isolated. This isolation accelerates further cognitive decline, fueling a self-reinforcing downward spiral. The data is clear. Individuals with cerumen impaction consistently show lower memory scores on the mini mental state examination than those with clear ears. To see if they could break this cycle, researchers followed 55 memory disorder patients to see if clearing their ears would change their cognitive trajectory. The intervention was straightforward: professional clinical removal of the blockage using precision irrigation and suction. Hearing improved by an average of nearly 5 decibels, enough to move several participants from severe hearing loss back into the moderate range. This chart shows the neurological result. While the control group's cognitive scores continued to drop, the scores of those who had their earwax removed actually rose. Age-related hearing loss puts an immense strain on cognitive processing. Removing the physical barrier alleviates that load, allowing the brain to reclaim lost function. Hearing this, the immediate instinct for many is reaching for cotton swabs to clear things out. But the research is specific. Self-cleaning is dangerous. Cotton swabs or ear picks are linked to infections, skin tears, and traumatic eardrum damage. Mechanically, self-cleaning backfires. In a narrow, aging ear canal, these tools rarely extract wax. Instead, they act as a ramrod, packing the debris deeper and creating the very impaction you're trying to prevent. To protect the brain, we have to change how we view hygiene. Earwax impaction is not a minor nuisance. It is a sensory barrier that actively accelerates memory loss. Attempting to dig out the blockage yourself only makes the impaction tighter and the hearing loss more severe. If an older loved one is showing signs of memory slips or hearing loss, schedule a routine otoscopic screening with a medical professional rather than assuming it's permanent dementia. Clinical irrigation is safe, fast, and effectively removes the barrier in a single office visit. Protecting our long-term cognitive health doesn't always require complex neurological drugs. Often, the best defense is simply clearing away the physical obstacles between us and the world around us.